Who's familiar with ACN? All right. ACN, they recently came on as a sponsor with the liquidity event, and I'm about to go crazy for them. Over the next couple months, y'all going to be seeing ACN everywhere. Make sure you check out their new website, ACNUnited.com. Make sure you visit it. But Lorraine is going to be coming up and giving a quick talk to let you know about what ACN does. If you don't already know, because I'm pretty sure they spread the word. Lorraine, please let them know a little bit about ACN.
Good evening, everyone. Happy Thanksgiving to everyone. Thank you very much, Mr. Ryan, for the information that you shared as well. And also, does somebody else smoke? Go for us. Yes, TR. Thank you very much. Thank you, TR. How's the lemonade? Okay, good. Alrighty, so ACN stands for All Communications Network. It's an affiliate marketing company. Right now, we are in the season of open enrollment. How many of y'all know what open enrollment is all about? Tell me about some of the pains going through with open enrollment. What's happening in the marketplace now with insurance? Go ahead.
Well, it's getting more expensive. And there's a lot of confusion out there.
Correct.
So you gotta have the right broker, the right agency to guide you through all the noises that you're hearing, so that you can get
Correct.
Medicare.
You focus on Medicare? Okay, great. Thank you. Were you going to say, Mr. Gary?
Same thing, say increase. It's been a major increase. I've been people telling they increased the numbers. My wife, where she works at, increased some numbers. Now she became an impact customer.
So we have a number of services with our ACN business. We have cell phone service, internet, TV service. We have services for both businesses and residential customers. Because of open enrollment, our main focus right now is actually impact health sharing. It's an alternative to the high cost of insurance. You heard Mr. Elliott here say that he was a heart attack and stroke survivor, and he'll talk a little bit in a few minutes. But the main message here is it's an alternative to the high cost of insurance. So if somebody, for example, we will do a couple of quotes in a minute. Let's say, for example, just so you understand what you get with impact health sharing. People are saving anywhere from 30 to 50%. Okay, I was actually in the marketplace, and I was had Ambetter. I was paying about $80 for my healthcare costs. If I kept that same plan, come January, I would be paying $916 just for myself. Okay, not even including my husband. I spoke with a gentleman in Dr. Joyce's BNI chapter, and he said, "Hey, let's talk sometime in November." We spoke a couple of months ago, and he said he called me last week. He said, "Listen, my rate is going up by $850 for my family of 5. Can we talk?" Absolutely. So people are getting the email, people are getting the text messages, people are getting the letters that their rates are going up. I was heard a lady on YouTube. She said she was paying $250 every 2 weeks for her health care. She said that's now going up to $750 every 2 weeks, and now she has to take her husband off the plan. Okay, so the numbers are becoming unaffordable for a lot of people. It's kind of like the insurance companies are totally tone deaf to where people are at. It's kind of, how much do you make? Well, I'll take 75% of that. You live on 25%. Really? So a lot of people are just going to simply opt out. So impact health sharing, as I said, it's an alternative to the high cost of insurance, providing people with medical freedom. Are you familiar with what utilization reviews mean? Anybody know what that means? So if Dr. Joyce says you need such and such, the insurance company will say, no, why don't you try this and this, or try this and that. With impact health sharing, there is no doctor utilization review. If Dr. Joyce says you need this, this is what you get. Okay. Also one of the biggest factors I think with impact health sharing is the fact that they actually do something called reference-based repricing. You get a bill, and I've seen a bill for a gentleman who owned a roofing company. He had a stroke. He would end up in the ER. They almost lost him. His medical bills were $540,000. Impact reduced those bills by $514,000. His out-of-pocket, less than $5,000. I've been in insurance for a long time. I know you've been in insurance for a long time. Have you ever seen anything like that? Never heard of anything like that. So when I say we are an alternative, an affordable alternative to the high cost of insurance, anybody have a birthday that they would like to get a quote just to see what the numbers would look like? Okay, go ahead.
My date of birth,
Yes, Mr. Trell is going to pull a quote for you.
5878.
5/8/1978. How much would that be, generally speaking? Would you know? I know you do Medicare. Regular. Off the top, okay. Okay, okay.
It'd be 3. Mhm.
The lowest amount is $456. The highest amount is $628.
And I understand that those numbers include vision and dental. It also includes everyone on the plan gets a wellness exam. There's no extra cost for the wellness exam. So the wellness exam is included, vision and dental is included, telemedicine. You can be face-to-face with a physician within 3 to 5 minutes and tell them what's going on. If you need to upload pictures, you have the ability to upload pictures, let them know what's going on, and they have you're speaking with a board-certified physician so they can write your prescription. I've used it several times. I know Dr. Joyce has used it as well. You have the ability to, I got a prescription written at Walgreens, went and picked it up, asked them how much it was. They said it was $110 when I got there. I gave them my card. They said it was $40. So impact for the win. So we've saved our members about $6 million in 2024. So the difference is with Impact and other insurance companies is Impact is a not-for-profit entity. Whereas your for-profit companies, let's say for example, United Health, last year they made $20 billion. So with Impact Health Sharing, those reserves, the monies that people are making, that Impact is making here, it's used to be a blessing, if you will, to the community. So people get extra perks. So they've added vision and dental, they've added the wellness exam, they've added something where you have something called Living Well Rewards, where you can go to the gym. If you have a DPC that you're seeing, if you're a concierge physician, anything that you're doing to increase your health, you have the ability to get a $150 credit that reduces your deductible, if you will, or what we call your primary responsibility amount. So you in effect can reduce your primary responsibility amount by $1,800 a year. Mr. Elliott, if you would come really quickly and just talk a little bit about why you're so passionate about Impact, that would be great.
Yes, I don't think I need that.
Yeah, that's fine.
Okay.
They taping it.
Thank you. I'm retired military, 34 years Army. And I really thought that I was covered. And let me tell you something, ladies and gentlemen. I was going through physical therapy, occupational therapy, speech therapy, and they came to my room one day, they said, Mr. Elliott, we no longer gonna cover all of it. Now, I'm thinking about going to mental health again because I'm thinking in my mind, I gave this country 34 years of my life, and why? So that's the reason why I started investigating insurance. And you know what I found out? TRICARE was just like all the other companies. They were for profit. And so I mean, I'm scratching my head. I'm like, wait a minute, because at first I didn't know what for profit was. But then I joined ACN, and you know how any business you start to research all the products, and I attached myself to Impact Health Sharing, and now I hold a health seat in my BNI chapter, and I promote Impact Health Sharing. Because again, they're not for profit. We're not paying for 3-story yachts and private jets. You can literally go to any hospital, see any doctor. Like Ms. Ray said, it also includes discount vision and dental. Now, wait a minute. So, I mean, nobody can't tell me nothing when it comes to insurance. And I'm not saying it to be mean, but I keep getting a call every day. And I tell them, I say, you know what? I don't support for profit. You ain't got nothing to tell me. And I explain to them why. But I think Impact is one of the greatest things out there, and thank you.
If we let him go, he will be here all night long. Okay, so again, like I said, we do have other services when it comes to our ACN business, but Impact Health Sharing is front and center simply because we are in open enrollment. Any questions? ACNUnited.com, and you can click on services and you'll see Impact Health Sharing.
Here, you take one of my bills.
All right, I was like, wait a minute. And if the ACN folks will raise their hand so people would know who to talk to. These are the folks with ACN. Dr. Joyce, Ray, raise your hand. Mama Asi, raise your hand. Everyone with their hands Well, stand up. Just stand up. Just stand up. Just stand up. Stand up. Stand up. Stand up. Stand up. The ACN team, stand up. Stand up. If you want to get a quote, if you want any more information, see any one of these beautiful folks that are standing up right here, and the other one over there, Mr. Farrell as well. Okay. All right. Thank you very much.
ACN.